So what is a flare-up? Follow along with this video as we discuss what a flare-up is, how to identify it, and how to deal with it with AS. You may have heard of the term flare-up in common parlance. Well, essentially, it is what it says on the tin. A flare-up we define as an increased period of your inflammatory levels raising. Now, again, much as we do in rheumatology, we are great at saying what's going on. Why not so good? We know there's tons of things that can influence, and there's just far too many to really be accurate. However, the nice thing is this is quite identifiable yourself, with me as a therapist, but also with your rheumatologist. Now, that increase in inflammation can definitely show medically. So that can show on your blood work, raised blood level inflammation markers. You can also pick it up, and myself. So how do we do that? Number one, are your symptoms worse? Pretty simple. Are you more stiff in the morning? Has your volume dial been cranked up another couple of notches, as we keep banging on about? Has that cranked up another couple of notches out of the blue? And you feel like you're taking longer to get going in the morning? Is your pain worse, particularly in the morning, but particularly after rest, or does it come on quicker? Key signs that you're potentially flaring up. Other things that are a little bit different, so thinking away from our primary symptoms, what can happen is we call them extra-articular features. All that means is non-spinal, not the norm. So if these start to come in alongside an increase in early morning stiffness or are coming out the blue, then maybe we're flaring up. If we think about our body over-inflaming, then it kind of makes sense that other parts of our body can also be affected. So I'll run through a few of the common ones. Number one, look at our hands, skin, psoriasis starting, and we're getting skin changes. Are we getting sausage fingers, which just mean they blow up out the blue for the joint? Are we getting nail pitting? Another key one. Costochondritis is a kind of odd condition where essentially our body in rheumatology attacks the joint between my sternum and my rib. That can be really painful, could mimic a heart attack, which is really nice for people, but generally tended to touch here rather than through one side. Furthermore, looking a bit kind of more globally, and a very common side effect of a flare-up is our enthesitis. And that just looks like tendinitis. An area, maybe elbow, wrist, very commonly Achilles or patella, kneecap. The tendon there can get really inflamed and annoyed. And now if you come to me as a therapist and say, oh, I've just taken up running and my Achilles really hurts, probably not in a flare-up, you've just annoyed your Achilles. But if you're getting all of this random pain, along with some other markers, then potentially we're thinking, yeah, you might be in a flare-up, let's deal with it. Other things to think of, which is really key as well, and I stress this quite a lot, is uveitis or iritis. Essentially means the white of your eye can become itchy and inflamed and actually can become red. That's something always to keep an eye on no matter what with AS, particularly because that can be dealt with really quickly with a couple of steroid eye drops. And we generally don't want to let people go too long with an inflamed eye because it sucks, but also, you know, there could be some longer term consequences. So we have identified, me and you, yourself, whatever, we've identified you are in a flare-up. So what the heck do we do about it? Well, number one, if it's been a week, I think we just kind of sit back, we let to see how symptoms are and how you're dealing with it. Oftentimes, in a couple of weeks, this just starts to settle down. We manage you, but it's probably not needed to rush to the doctor. However, if this is carrying on for 4 or 5 weeks, your morning stiffness is continuing to creep up, you're starting to lose your function, then definitely I would be writing straight away to your rheumatologist to say, actually, patient X has been flaring for a month, it seems, because of all these reasons. Let's just have a quick blood test, and can we have a look at this patient ASAP? Normally, the rheumatologist is really happy to book you in nice and early, and then they can deal with it medically. So oftentimes they may give you an increase or a change to your medication in the very short term to allow the inflammation to drop, or your volume dial to clunk back down, back to your baseline, and then we withdraw those drugs and we keep you kind of where you were before the flare-up. Sometimes that looks like prednisolone. That can look like many things that I'm just utterly not qualified to prescribe or do anything, but I will tell the doctor, look, we need to get involved here. So you're in a flare-up, gutted. However, what do I do and what can we do together about it? Well, I don't just ship you off to the doctor. Hopefully we don't need to. What I like to do one-on-one, whether that's virtual or whether I'm seeing you face-to-face, is we make a bit of a flare plan. So all that looks like is taking a few things that we can implement to calm down our inflammatory levels. Now, a lot of this stuff is not complicated, but when you're in a lot of pain, it's actually quite difficult to see the woods through the trees. So what I would say is we can produce a flare plan, a couple of step guide, and then we can implement that for the future, possibly not needing to come and see me when you do have another one or a start of another one. So number one is looking at our overall week's activity level. Can we find little areas we can drop down, do a little bit less? Sounds really simple, but if we can deload a little bit of the things that flare us up or annoy us really when we're in a flare, then hopefully we can start to control that just for that couple of weeks as we come kind of out of the flare. Number two, implementing pain-free activity, things like a little bit more cycling maybe if your back can tolerate it. Swimming. I hate swimming. You couldn't get me to swim enough, but potentially I may suggest, why don't we try and go to a pool, go to a body of water that's comfortable, get in. What's lovely about swimming is you take your weight of the world out of you, figuratively and literally. You move and you take 60-70% of your body weight away from gravity. I love it. Personally, I don't like swimming, but whatever, that's me. I'm just not very good at it, essentially. I would jump onto the bike, but again, I don't have AS. Cycling, low-level things that you might not have thought about, we could implement them just to get your kind of overall inflammatory level under control, or to at least ease your symptoms to make things a bit more manageable. Furthermore, thinking of work, we're going to work kind of flare plans, so I'm very happy always to correspond with bosses and colleagues and whoever needs HR, whoever needs to be talked to, whether we can say, actually, give you a bit of kudos behind you're really struggling at the moment, if we can be on some modified duties for just a couple of weeks. That can hold great help with people. What I don't want to see with patients is that you're in a flare-up, you're going gung-ho and you're just in so much pain you can't cope. Because when we're in pain, as we keep going back to, pain is inhibitory. So if, let's say, you've got a massive flare-up, your back's all, your stiffness is up, your back's in pain, you also have massive elbow pain, and we don't do anything about it, then essentially that inflammation is switching off the muscles in and around our elbow. So what we do is we try and implement a few strategies to keep the strength while not annoying you. Things like isometric contractions are great use when we're flared up to keep and maintain some strength and to hopefully just reduce a little bit of pain. If we are just with myself and we haven't gone to the doctor yet, we will take a comprehensive look at your life and really to hopefully look at those flaring symptoms and see anything that we can implement to calm you down. Other things I know a lot of patients like, particularly with our enthesitis or certain hand conditions, is that we can stick it in cold water, use a bit of ice therapy, and just overall look at your week, implement some of these random strategies I've just kind of touched on to really settle down or at least stop annoying the flaring symptoms so we can manage you out of the flare-up, and then my job really starts. Then we slowly recondition anything that's been weakened or extra painful. Then the physio's job is basically to kind of put you back together, essentially, get you stronger, get you functioning, and hit those goals once again. So hopefully you understand what a flare-up is, how to kind of identify it yourself, and hopefully then with your clinician or someone close to you that you can really look and say, go to your rheumatologist or your doctor and say, I think I'm in a flare-up because of this. Or you come to your therapist and we can do that with you through some email or letter correspondence. Hopefully you've seen that we need to manage you in and out of the flare, particularly out, but potentially looking at our peaks and troughs, calming you down and avoiding that boom or bust cycle when you're particularly annoyed. The cool thing is, most people will just get out of that flare-up. That's not their new normal, and we can get back to the baseline of function that you were at pre-flare. So thanks for joining me again. Keep following the channel as I look to grow and expand this collection of exercise, education, and self-management strategies for everything AS. Thanks very much.